Hi, Frederico and Romaine. How are you? Just doing the sound check and everything. And Lisa, hi, welcome. Can you guys hear me? If you can send me a little message under the chat or Q&A, that would be amazing. I'm glad you're here today. Awesome, thanks. All right, I'm gonna try and get this going. We're gonna start in a couple minutes. I need to make this go live on Facebook, so bear with me here. If you're just tuning in, I'm switching over to Facebook Live, so hang in there. We'll start in 3 minutes. Good morning, everybody. Good morning. For those of you who are just joining, we'll be getting started in just another minute or two. For those of you who are just joining, we'll be getting started in just another minute or two. Looking forward to having everybody here today. We've got people on from all over the world. So this is the first time we're doing Zoom and live Facebook, and I'm getting a little delay. So let me know how this is coming through for you guys. For those of you who just signed up through Zoom, what I may have you do is switch over and go to Facebook, go to the Cancer Exercise Training Launchpad, and then you can just watch this live. I want to make sure you have the best experience possible. Launchpad, and then you can just watch this live. So I would love for you guys to let us know where you're at. I see hello from Texas. I know we've got people signed up all kinds of places all over the world. This is such a fabulous way for us all to connect while we are quarantined in our homes. Hey, Shannon, I'm glad you're here with all your muscles. Can everyone hear this okay? Good morning, Philadelphia. Hey, Tracy. Hi, Kella, Shanna. Good morning. Okay, well, it is 9:01 here in beautiful Santa Fe, New Mexico, and I am thrilled to have you guys here. Is there a delay when you're watching this? Because when I'm watching it, it's all, everything's coming in later. Hi, Niagara, Canada. Welcome, Amanda. Hi, Marcel. Hi from South Carolina, Arkansas. This is so exciting. Hey, Teresa. Hey, Denise, Penny, welcome. Dubai. So awesome. Well, when life gets back to normal, I am looking forward to getting there to Dubai and back to the Middle East. I was just in Jordan a couple weeks ago teaching a live workshop. Hi, Jennifer. Hi, Kella. Welcome, welcome. So super excited to be here, and you guys have all had interaction with Shannon Burrows, who is my counterpart here, although we can't see her beautiful face. You've seen her videos, and Shannon and I are both cancer survivors. Shannon has more recently gone through breast cancer, and I am a 36-year cancer survivor. Let's see, 1984, I was diagnosed with thyroid cancer. And that is what actually got me into fitness because of my own struggles with my weight and my metabolism. You know, at 18 years old, it was a very difficult thing for me to cope with, in addition to being told you have cancer. I want to give you a little bit of background just so you understand, you know, who I am, why I'm here talking to you. As I said, I'm a 36-year cancer survivor, but my mother is now fighting stage 4 breast cancer, and she was first diagnosed when I was 15, and then again 15 years later was diagnosed for the second time. At this point, I was a fairly new personal trainer. I'd been doing it for about 5 years, and I was the director of personal training at the National Capital Y in DC. I fortunately was training my mom's breast cancer surgeon, and my mom had asked me, you know, can you help me this time to recover so that I don't have all the same issues I had the first time, which she wasn't told to move her arm. She ended up with a frozen shoulder. She had chronic pain from nerve damage and became addicted to narcotics. Ended up spending a summer at Johns Hopkins going through detox. And, you know, to this day, she's still suffering with chronic pain. In any event, I said to her doctor, what do you think about writing a book on exercises for breast cancer? Now, keep in mind, in 1995, the internet was just starting. There was nothing out there. And so this was way before its time. And, you know, here I was, just a lonely little personal trainer. Well, I spent the next 3 years working with the chiefs of breast surgery at Georgetown, Johns Hopkins, and GW University, which are the preeminent educational training hospitals in the United States. And we wrote essential exercises for breast cancer survivors. Well, although that book is now 20 years old, it's amazing how relevant the material in it still is. And all of the basic information has stayed the same, but the treatments, the surgeries, the protocol, everything changes literally on a day-to-day basis. And so after I wrote that book, I realized there was a much greater need beyond breast cancer, although that's a tremendous need. And I decided that I needed to create more people like myself to help the millions of cancer survivors and patients that were out there. So what better way to do it than to become an educator? And when I look back at the humble beginnings and teaching workshops on the roof of a gym in LA, or sitting on equipment in some little facility in Florida, whatever it took, I was determined to get out there. And in 2004, I started the Cancer Exercise Training Institute, which was kind of the beginning of where we're at now. Started off with, like I said, just breast cancer. Now we cover 26 types of cancer as well as pediatrics, and everything you ever wanted to know or never wanted to know about cancer, surgery, treatment, recovery. We now have a 500-page manual, just to give you an idea of how much content there is. And we update it every 2 years, which still isn't often enough, but it's critical to make sure that people who are working with cancer patients know all of the details. And I guess the best way I can convey this to you is it's like a mathematical equation. You take A, which may be the patient's health history. B is the surgery, what type, where is the incision, are there multiple incisions, was there an amputation, when did they have it done? In other words, how long has it been since the surgery? Then we take the treatments, the acute and chronic side effects. Hey, Melissa. Hey, Jennifer. The acute and chronic side effects and how we intertwine that, because many of the side effects, as I'll discuss this week, can be prevented or minimized with exercise. So how amazing is that? And then we look at whether or not they're at risk for lymphedema and what their personal assessment is. And we take all of this and wrap it into a nice little ball, which we then can turn into a customized and individualized exercise program. And that's really key. So I don't know if you're aware of this. It's kind of hard not to know how many people have cancer in the world, but we're inundated with all of the news about coronavirus, and everything else seems to kind of fall by the wayside under these current circumstances. My mother, as I mentioned, is a stage 4 breast cancer survivor. She is in Washington, D.C., and currently I'm in Santa Fe, kind of self-quarantining here. But she's expressed to me how lonely and scared she is. She was already scared of having stage 4 cancer, but now she's isolated in her home, dependent on other people, and really somewhat hopeless. And as a cancer exercise specialist, it is the most amazing feeling at the end of the day to know that at a time when people, meaning cancer patients, feel that cancer has stripped them of everything, and it does. And I know Melissa and Shannon and Frank and many of you who have had cancer yourself understand this. The minute you hear the word cancer, your whole world changes. And it can be better afterwards when you get to the other side. But at that moment, you know, you're thinking of what kind of treatment I'm going to have, how am I going to afford this, you know, am I going to lose a body part, am I going to lose my job, how am I going to pay the bills, what about my children, and many of these things we're all thinking of now with the coronavirus, and our world is turned upside down. So we can relate better than ever to what cancer patients may be going through. By 2030, there are going to be 23 million or more people living with cancer. So that means they have been diagnosed within the last 5 years. That is not to mention the people who are being diagnosed each year, so hundreds of thousands or millions. And this is everywhere in the world. We all are affected. I'd be really curious if you guys want to write in the comment bar, what is your attachment here? You know, why are you here on this webinar? Do you have cancer? Have you been through cancer? Do you have a loved one or a friend? Or is this just something you're passionate about? Because I'd love to know, you know, each of your stories and how I can help you more. Because at the end of the day, my goal is not only to educate, to keep you updated with the current principles and you know, treatment practices and all that, but I want to help you get through this. because whether you are the patient or whether you are the caregiver, it takes its toll either way. Any of you guys caregivers out there? Okay, let me ask you, as you guys are telling me this, is it okay if I, well, actually everybody can see it. So Shanna and Marcel are sharing their personal stories. Thank you for sharing. I think it really helps to when you know that there are other people in the same situation, and that, you look at somebody like myself, and although I had a very simple cancer, if you will, 36 years later, I'm here, guys. I'm sorry to hear about your loss, Amanda. I lost my dad 5 years ago. He had prostate, bladder, and myodysplastic. Okay, so keep sharing, guys. It's really important. But I'm going to go ahead and let's start talking about what we can do. Now, some of you are probably cancer survivors, cancer caregivers, and others are fitness professionals. So I'll try and talk to everybody here. One thing that is so critical is if you are working with cancer patients, you have to understand everything from beginning to end, no matter how passionate and compassionate and wanting to help people you are, you may actually be doing more harm than good if you don't understand every component. Tracy, I think you, Tracy Green, your family and my family drank from the same well. I have 23 first-degree relatives who have had cancer, so it's amazing. Thank you guys for sharing. We know that exercise, along with a healthy diet, can prevent cancer. It's all over the news. Why then do the majority of people not change their lifestyle habits? I suppose that's the $64 million question, right? We know that smoking, that drinking alcohol, that a diet high in animal products and high in saturated fat is bad for you. We know that sedentary behavior is bad for you. However, at least in the United States, I think that 60% of the population is obese, including children. And we have to look at the comorbidities of cancer, because many things go along with it. Oftentimes you have people who are unhealthy and they have heart disease, they have diabetes, they have osteoporosis, Alzheimer's, brain health issues, you name it. It all goes together. And it's not because everybody has poor health habits. A lot of it is because of oxidative stress. Now, I was gonna do a pop quiz to all the cancer exercise specialists who are here, but oxidative stress basically is everything around us that we put on our body, in our mouths, the air we're breathing. It's the pollution, whether it be through chemicals, radiation, even high amounts of sugar, that basically changes our DNA over time. Okay, does anybody have a guess? And the people who've gone through the course can't answer this. What percentage of people with cancer have the genetic markers and predisposition? What percentage of people with cancer do you think have the gene or have one of the 200 genes? Anybody have a guess? Melissa is the superhero of cancer survivorship, guys. Anybody have a guess? What percentage of people with cancer have it because of genetic reasons? All right, nobody wants to play. 5, okay, Marcel, thank you. Even less, 5 to 10% of all cancers. You got it, pretty close there. All right. I mean, Denise, we would think it'd be 50%, right? But only 5 to 10%, which means the other 85 to 90% of people with cancer are getting it from their environment. From oxidative stress. All right, so my whole point in this, hey Siobhan, thanks for joining us from Ireland. I hope things are not as horrible as they are everywhere else in the world. Anyway, I got a little sidetracked there. I got excited to see Siobhan. Okay, so what if we, especially during this time that we are all on the internet, how about start talking about ways to prevent cancer? Talk to your churches, your synagogues, your mosques, your support groups, your friends, your family, and tell them that by making very simple changes, that they can help prevent cancer. And cancer is really a byproduct of dis-ease. Your body is at dis-ease and inflammation. So when we reduce inflammation, inflammation is connected to so many chronic diseases, and it compromises your immune system. Hey, from Lithuania, welcome. So exciting, I have goosebumps. If we can reduce inflammation, improve our immune system, we have a much greater chance of fending off all of these diseases. And I don't want to keep talking coronavirus, but I think this is an eye-opener, and this is a perfect time for us to talk to the people we love, the people we like, the people we don't know, and let them know, look, things are going to happen in life, and we have to strengthen our immune systems. Welcome, Erica. Good morning. So, you know, you can't out-exercise a bad diet, so we have to talk exercise and nutrition. But in 85 to 90% of the cases of cancer, potentially, they are preventable. So even though a lot of times we're talking about working with cancer patients once they've already been diagnosed, let's look at that element, that group of people that have not been diagnosed, but that are high risk. And many of these are the same people who are at high risk for coronavirus with a compromised immune system, high inflammation, high percentage of body fat. Their body is in dis-ease. So let's make the world a healthier place. Now, we've got very few people, but sometimes you will have the opportunity to work with people in prehab. And the window is very small, because when you're diagnosed with cancer, the last thing you're thinking about is, hey, I'm going to get ready and start an exercise program. That sounds great. But what if we could work with the medical professionals? What if we could volunteer to work one day a week, one day a month with an oncologist, with a surgeon, and offer to do an assessment where we can get a baseline of where they're at now, their postural assessment, muscle imbalances, range of motion, biomechanics, balance, all of these things that are integrated into a comprehensive exercise program. We come up with a baseline. If we do nothing more than that, at least we have something to compare to when they get out of surgery and they're ready to begin exercising. And in some cases, if the cancer isn't as aggressive, they may have a month before they start treatment. So in that case, we can speak with the doctor, of course, working around all the HIPAA issues and legal issues with that. But what can we do to make this individual stronger and better able to handle all of the issues that come along with surgery and treatment? So again, that's a very small window for prehab. But now let's say we're starting to work with somebody who's in cancer treatment. Study after study after study shows that people who continue or begin an exercise program while going through cancer treatment have better satisfaction with life, are better able to handle the activities of daily living. Now imagine the things that we take for granted, like reaching into a cupboard, like being able to scratch your back, blow dry your hair, put on your clothes, your brassiere, whatever. Even getting on and off of a toilet when you are so fatigued that your legs can't lift you up. We take these things for granted. But these are all things that studies show can be improved. Better sleep. Without sleep, your body can't heal. Your body needs that downtime. Many people with cancer are depressed. So exercise and the endorphins it produces can help minimize depression, which is huge. And I know as I'm saying all these things that you can relate to what we are going through globally with coronavirus. I just want to show you the parallels because it really is in essence the same thing on many levels. We have patients that are stronger and have more energy. So 76% of cancer patients going through treatment report horrible, horrible fatigue. And I know you folks, I know we've got Frank, we've got Melissa, we've got Shannon, I'm sorry, I know there were other names I've got to scroll back who have gone through cancer treatment, and I know you guys can all relate that this is like mind-numbing fatigue. So especially if we can encourage cardiovascular exercise, that will really help with the energy. And it's not gonna, they're not gonna be running an Ironman while they're going through chemo or radiation, but it can certainly help with the energy, which is gonna help them get through day-to-day activities and do the things that are more meaningful. One of the problems right now with all of us being in quarantine is we're not able to do a lot of the things that bring us joy. And for many people who aren't able to cope, that can lead to depression. Okay, Tracy, so yeah, you can relate as well. Fatigue is a huge, huge issue. And as we go through these webinars this week, I'm going to talk to you about the parameters. Today is kind of an overview, and then we're going to talk about how do you train somebody when they're at that level of fatigue? How do you train someone who's undergoing chemo and radiation versus somebody who's recovered? So I promise I'm going to give you all this great information this week, but I just want to touch on the basics right now. All right, so generally speaking, the person who exercises during treatment is going to have all of those benefits, plus minimizing pain and treatment side effects. I mean, every medical professional, based on that alone, should be prescribing exercise. And yes, Shannon points out that, sorry, my nose is itching. It's very dry out here. Mindset is everything. If you take the person who is Chicken Little and saying the sky is falling versus the person who is looking at every single day and being grateful to be alive. I'm glad you think that's funny, Shannon. It's funny, anytime you're like I'm on, it's like everything starts to itch. I say to each and every one of you, and this is a great thing to say to everybody else. I read this in some book I was reading last week. I'll hit on that in a second, Teresa. Every day you should be being thankful for something or many things, okay? And I go through once or twice a day all the things I am grateful for. And in this book that I was reading, it said, if you can't find one thing you're grateful for, the problem isn't with society and the universe. The problem is with you. Because at the very least, I am grateful to be alive today. And I am grateful to be here with all of you and to be reaching people all over the world. So hitting on that, Teresa, yes. Nausea with chemo, I think, let me see what day. I'm talking about that tomorrow, okay? So we'll talk about how to modify exercise programming when people are having nausea, vomiting, diarrhea, all of those things. So I promise to hit on that tomorrow, but obviously we're gonna work at a level that people can tolerate. Also, yes, neuropathy, lymphedema, fatigue, I'm gonna hit on all of that this week. So, but if you think about creating a brochure, and you've got your trifold brochure, that first page is benefits of exercise during cancer treatment. And each of these things that I'm talking about are little bullet points. And Shannon and I will have handouts for you guys as we go through the week. We'll give you some handouts about lymphedema and ways to promote exercise, all these. So we're gonna really work with you this week to make you feel confident and secure with what you're doing, both as a cancer patient and survivor and someone who's working with them. All right, so now we get through treatment, we're on the other side of that, and people have compromised immune systems, okay? Until their immune systems are at a level where their red blood cell counts, their platelets, their white blood cell counts are okay, we have to be really careful about the environment. And this, again, compares to the coronavirus because their immune systems are not able to fight off the basic infections. So maybe we go to their homes, and of course, this is all post coronavirus, but right now we have the perfect opportunity, right? We just go virtual, and that way we don't even have to wear a mask. But in other times we work in a quiet area of the gym. Try and keep the areas free of things that they could trip on or stumble over, because if they have low platelets, they may have excessive bleeding, bruising, and also just less able to control the bleeding because of the low platelets. Also, people, and I know you guys can relate, I've heard the term what is it? Breastless, bald, and barfing, or something like that. Bald, breastless, and barfing. And that's, of course, with breast cancer. But, you don't want to necessarily go into a gym where everybody's all fit and beautiful and whatever. Even though you are just as beautiful without hair, without eyebrows, without breasts, without testicles, we may not feel that way at the time, right? And you can relate. And Melissa, you have been so amazing. The times I've met you in person and sharing your story and, talking about alopecia and wearing a wig, not wearing a wig. It's so important to be able to share these stories. Hey, Demetrius, welcome from Greece. This is so great. I hope you guys are all healthy and well and getting by during this difficult time. Okay, so talking about the immune system, also obviously if somebody's gone through a bone marrow transplant, stem cell transplant, their immune system is compromised. So we need to take all these precautions. And at a time when someone is immunocompromised, if you guys are sick, if you even have a sniffle, you do not want to work with them. Take that day off. We want to make sure they bring their own exercise mat, or they're putting a clean towel down, especially if we're in a public gym. Bring their own water bottle. Don't drink out of the water fountain. Wear exercise gloves or use hand sanitizer. Of course, now nobody can get it anyway. So I have these new hot pink gloves I'm wearing if I have to go to the grocery store and whatnot. But you want to take all of these precautions. We want to protect this person more than anything. This is not about how much money we make at the end of the day. This is not about only building our personal training business. This is about caring for people who truly need our help, who are relying on us and putting their lives, in essence, in our hands. Because once again, if you are working with somebody and you don't know all the ins and outs, you can do more harm than good, no matter how good your intentions are. So this is where I come in, and Shannon and everybody else, and try and help you out here. All right, now we want to assess this client coming out of treatment and see, what are the changes? And we don't have a baseline if we didn't do a prehab assessment. But either way, we want to look at range of motion, especially for anyone recovering from head and neck cancer, for somebody who's had a mastectomy, radiation to the chest, breast reconstruction. This can all affect shoulder range of motion. So think about any exercise that you do. It could be jump rope, it could be aerobics, Zumba, TRX, Pilates, yoga, I don't care. Think about the range of motion that's involved. All right, so when I raise my arm up like this, I think automatically of warrior one in yoga. And you think of yoga as healing, as meditative, as just, very introspective, and I don't want to use the word easy because it's not easy, but where anybody could do it. But if we take the person who has one arm that goes this high and one arm that goes this high, and we have them hold that yoga pose for 20 to 30 seconds, we are strengthening those limbs in a limited plane of motion, which is not ideal. Before we even do that, we need to address and correct any range of motion limitations before we place a load on that particular limb. All right. And that even includes something like yoga, holding a pose. It's an isometric load, if you will. So we need to have a way to assess range of motion, and we use what's called a goniometer. You can Google it if you're not familiar with it. Unfortunately, because I'm in New Mexico and all of my stuff is back in Portland, Oregon, I can't even show it to you. But if you Google it, you can certainly see what it looks like. But essentially, you've got this circular area and the axis of rotation in the center, and then two arms, and we can use it to measure the range of motion at the joint. So the bottom line is we see where they're at now, what our goal is, comparing it to the norms. So for example, if flexion is 150 to 180, we need our client to be at least 135 degrees range of motion in flexion before we have them do anything in this plane of motion. And that includes holding a yoga pose. So if you're a yoga instructor, consider a fluid motion, all right? They don't have to hold the pose. Keep going through the motion, trying to go a little bit further each time. Once we get the desired range of motion back, then based on the postural assessment, which is critical, you guys, if you are a cancer patient yourself and haven't had one done, or if you're a fitness professional, postural assessment is the most valuable thing in my 28 years as a personal trainer, to identify which muscles are tight, which muscles are weak. And if you understand the concept of reciprocal inhibition, so if I contract my bicep through the process of reciprocal inhibition, my tricep has no choice but to stretch. So I want you to think about something real quick. If someone has a mastectomy and they have radiation in their chest wall and they have reconstruction, what happens when the pectoralis muscles become spastic? Okay, we have a lack of blood flow to the area and everything is shortened. It's pulling the shoulders and the head forward. And because of this spasticity, we may have ischemia, lack of blood flow to the area, and that is what's causing pain. Now, while they're in this constant state of contraction here, what is happening to the opposing muscles? The upper back muscles, the mid back muscles. They are overstretched and oftentimes weakened. Now, this is very much a generalization, but hopefully you follow along with me here. So if I stretch the chest and I strengthen the back through reciprocal inhibition, I am going to help to correct that muscle imbalance. Thank you, Sherry and Teresa. I appreciate that. So we have to look at the entire body because we're connected by that kinetic chain. You know, think about the little skeleton, you know, in the science lab, right? You don't see the humerus floating over here and the femur floating over there, and the sacroiliac is in a different place in the room. Everything is connected. So we have to look at the entire body. And when you're doing a postural assessment from bottom to top, from top to bottom, we need to have them do things like a squat test and a modified Thomas test so that we can be even more precise. I mean, I can do a postural assessment and see an anterior tilt, which is what would be the layman's term, sway back, okay? And I could assume that their abdominal muscles are weak and their low back muscles are tight, but it may not just be that. We have to look and see if they have tight hip flexors, weak gluteal muscles. Now, for those of you who are not fitness professionals, you probably have no idea what I'm talking about. And please feel free to reach out to Shannon or myself, and we can make recommendations to you individually. There are a few people that are in this group today and this week that are cancer exercise specialists that have gone through the program. And I'm sure I can speak for myself that we will be willing to help you guys and make recommendations. And for all of you who are fitness professionals, either this just validates what you already know, piques your interest to learn more, or makes you realize how much you don't know. And we're all at that point sometime or another. Okay, so we've got the postural assessment, we've got the range of motion, we've got all of the physical things that we need to look at correcting. But we also have to take into consideration with each and every individual, what is the most important thing right now? So somebody mentioned earlier peripheral neuropathy. Peripheral neuropathy is the burning, tingling, numbness, pain in the hands or feet. It is often caused by chemotherapy. However, it can also be from diabetes. And let's make this even more complicated by telling you that diabetes can be a long-term side effect of chemotherapy. So if your client presents with peripheral neuropathy, I want to make the recommendation that they go to their doctor and find out if they also have diabetes, because that, of course, is another, ball of wax. So if someone has peripheral neuropathy in their hands, fingers, I want you to think about the exercises you're choosing for them. If they're holding a band or a dumbbell or a barbell, and they have a difficult time with, articulating these small movements and fine motor skills, what if they drop it or let go of the band? It could hurt you, it could hurt them. So if someone has peripheral neuropathy with their hands, I suggest using machines, isometrics, anything that eliminates the risk of anybody getting hurt. If they have peripheral neuropathy in their feet, you want to avoid all high impact activities. So anything with jumping and even though rebounding and mini tramp is amazing, if it causes them pain from the impact, then we want to avoid that. Walking could be too much. So things like swimming or being on a stationary bike, a recumbent bike might be great alternatives. In some cases, it's going to be marching in a chair, depending on your client. Maybe they can't even stand up. So there's really a wide spectrum of, minimal side effects to really painful. Also balance. Peripheral neuropathy in the feet obviously can affect balance. And if anybody has any neurological issues as a result from cancer treatment, or they have primary or secondary brain cancer, then we need to take these things into consideration. They must work on balance, but we certainly are not going to put them on balance discs or a BOSU balance trainer because of the risk of them falling. We need to work up to that. So we have to have progressions and regressions and be able to start with just standing on a flat surface and see if they can stand on one foot without falling. And then, maybe we start off with them holding onto a chair. And if they can do that, then we try it without holding onto a chair. And if they can do that, then we go on to the next level and the next level. And at any point, if your client starts to experience pain or have difficulty, then we back off. We don't keep moving forward. So even though, I know I can help my clients get from, A, where they're at now, to D, where their ultimate goal is, we must do it safely and effectively. We also need to know if they've had lymph nodes removed or irradiated, because if they have, they are at risk for lymphedema. So for those of you who are not familiar with it, lymphedema is the swelling, usually extremity, arms or legs, but it can also be the trunk of the area that has had lymph nodes removed or irradiated. This risk is forever. It does not go up or down based on time. And things like excessive adipose tissue, older age, and poor nutrition all contribute to it. So we say to ourselves, okay, this person's at risk for lymphedema. A, I need to incorporate lymph drainage exercises. B, we need to work with them on a nutrition program, refer them to a registered dietitian or nutritionist who specializes in working with cancer, because it's out of our scope as a fitness professional, to help improve their body composition and also get the right nutrients to improve their immune system. Because remember, the lymphatic system is what's in charge of defending our body against infection. So when the lymphatic system is trying to fight off an infection, the lymph fluid is going through our body like it normally does. But now we have limited or restricted pathways after radiation or lymph node removal. So it may not work as efficiently. and there may be a backup. So doing these lymphatic drainage exercises will help to promote lymphatic drainage. Then we also determine, in most cases, people have to do weight-bearing exercises, particularly if they are on hormonal therapy, men or women, they are at a higher risk of osteoporosis. And also anyone who has gone through chemotherapy, one of the long-term side effects of chemo can also be osteoporosis. If they're on corticosteroids, it increases their risk of osteoporosis. So if they have all of these things, then we go, man, we have to have them doing weight-bearing exercise. Have to. All right, so we know they need to work on balance. We know they need to work on range of motion. We know they need to do weight-bearing exercise. They need to do lymph drainage exercises. What comes first and how much? Because when somebody's really fatigued, they may only be able to work out for 10, 20 minutes. So in that 10 to 20 minutes, what is the most important thing for them to be doing? And then we also have to think about functional activities, because I don't care about doing bicep curls unless there's a reason for it. You know, somebody in their day-to-day living, they do a lot of lifting. Or if they have to push themselves up out of a chair on a regular basis, working the triceps is important. Everyone needs to be able to do a squat, and they need to do one with good form and minimize or eliminate pain. Because, you know, if I ask 100 people if they have knee pain, probably 75% of them are going to say yes. And of those 75%, 50% are going to say, oh, I can't do squats. They hurt my knees. Why do they hurt their knees? Well, if you watch them do a squat test and you look at their biomechanics, you can look and see if their knees are medially or laterally rotating, if they're, you know, knock-kneed or bow-legged. And then as a fitness professional, we can work to correct that by choosing the proper exercises and teaching somebody how to do a squat with good form is basically giving them their freedom back, because everything, we got to get on and off a toilet, in and out of a chair, in and out of a car, on and off a sofa, whatever the case is, people have to be able to squat. So the trained fitness professional can identify these muscle imbalances and work to correct them. And of course, with some people, it'll be sooner rather than later, because there's only so much you can accomplish when somebody's, you know, working on an empty gas tank, so to speak, like somebody who's got major fatigue. So we need to prioritize. We need to determine what the most important things right now are. And it might be balance, and it might be a particular functional activity like a squat. And this is going to change. It's going to change from day to day, from week to week, from month to month. So it's really important to talk to your clients, or if you are the cancer patient, to communicate with your trainer or your physical therapist, your physio, and let them know. You know, don't try and be a tough guy. Don't act like nothing's going wrong, because we can't help you unless we know all of the intricacies. And that's the thing. Like someone who's going through cancer or recovering, even if it's 10 years later, can't just go to Joe personal trainer or Zumba class or Pilates or whatever and expect that they're going to get what they need individually. Because if I take 10 different cancer patients going through the same exact treatment, they're the same age, same gender, same activity level, each of them is going to have a different response to treatment, period. So putting together a class is quite challenging. I will talk about that as well as we go through the week. I don't want to overload you. You know, when I teach my workshops, they're a minimum of 16 hours. So mind you, we're condensing all of this into a very short period of time. So I'm trying to give you as much as I possibly can. All right, then, so we've got, you know, the immediate recovery. Then you might get clients who are 5 years out, 10 years out. We still want to do the assessment. We still have to do a postural assessment, have to look at range of motion, have to look at biomechanics. Because if we don't do that, there's nothing personal about it. And we continue to encourage people to exercise. I mean, how many times are you in a group class, either as a student or an instructor, and you see people who, you know, they're eager and they're keeping up with everyone in the class, but their movements are horrible. And the instructor isn't correcting them, maybe because they can't, there's 30 people in the class, maybe because they don't want to embarrass the person, whatever the case is. but it's not doing anyone any good, because the more you continue to work out when your body is not properly aligned, you are causing undue wear and tear on the joints. And just like a car, if the wheels are out of alignment and you're driving that car and one of the tires and one of the wheels is rotated out to the side, eventually it's going to blow. And the same thing's going to happen with your knee, not blow, but you may end up having an ACL issue, MCL, whatever. Whatever the issue is, it's not going to be good, and it's probably going to require surgery, physiotherapy, physical therapy, whatever. I want to finish off today with talking about survivorship. When people are done with treatment, there's this sense of relief. It's over. And that is kind of mixed. It's almost like the angel on one shoulder and the devil on the other, with fear, loneliness. Suddenly, the safety net that was their medical team is gone. They go from once a week to, I'll see you in 6 months, let us know if anything's wrong, whatever. And the patient is sitting here going, I don't know what to do. They didn't tell me what to do. Do I eat the same way? Can I go back to my workout? Will I hurt myself? I'm already hurting. I don't want to hurt more. Or maybe they had physical therapy and it was painful and they're scared to death to exercise again. Many people don't even know about lymphedema. So if you all, when Shannon and I provide for you the handout on ways to prevent lymphedema, man, blast that thing all over the internet. Let people know, hey, if you had radiation, if you had lymph nodes removed, you are at risk. Even if it's nominal, here are the ways to prevent lymphedema. So as a cancer exercise specialist, I feel that, yeah, right, Tracy? I feel that I am not just an exercise professional, I am an educator. I'm a wellness concierge, if you will. Now, nutrition is out of my scope of practice. I'm not a nutritionist, I'm not a dietitian. But I can certainly, at this time, especially when we can't be, face-to-face in person with our clients, I can be checking in on them. Hey, Joe, what'd you have for breakfast today? Oatmeal. Okay, that's awesome. How about putting some blueberries in there, maybe some flax seeds? That would be great. Are you making sure you're having 3 solid meals a day? Are you getting 11 servings of fruits and vegetables? What are you doing for activity? How much TV are you watching? How much time are you spending on the phone? Keep that communication going. It's not just about the physical. Shannon mentioned it, I think, earlier. It's state of mind. And so reach out to people right now. Let them know you're there, even if you're not here, right? Give them different exercises to do. I just started another another group on Facebook yesterday. I'm trying to remember what it's even called. I think it's called, oh gosh, I'll post it in here, but it's something like the 10-minute quarantine workout for baby boomers. And I invite all of you fitness professionals and survivors, join that group, because what I'm doing is I'm getting fitness professionals from all over the world to post 10-minute workouts geared toward baby boomers. So, helping them to do things like work on their balance, work on injury prevention, breathing, meditation, and it's free. So I'll put the link here when we're done today, and please share it, join, be a part of it, post your videos, talk about yourself, say what your credentials are. And if you are not a fitness professional, utilize the information that we're going to be providing for you. I'm so excited to be able to do this. This was actually a suggestion of my mother, who says at 81, thanks, Shannon, 10-minute quarantine workouts. My mom says, 81 years old, I can't do these half-hour workouts. Can you just do something for 10 minutes? Yes, done. Okay, so back to survivorship. People who exercise after cancer treatment, study after study shows that their life expectancy is better than their counterparts who do not exercise. So we have people who are reaching new heights in strength, in endurance, in all types of fitness, people who never exercised before. We've got self-esteem, self-confidence, better abilities to perform the activities of daily living. That can include sport, retirees who are playing golf and tennis and swimming and working out, all the things they love to do. They're going to be better at it. Okay, we've got people whose immune systems are healthier. They are better able to fight off infection. We're going to help minimize their risk for osteoporosis, minimize the risk for diabetes, and combat some of the damage potentially from chemo and radiation to their heart, to their lungs. Exercise can help minimize or prevent all of this. So exercise is medicine. Any way you look at it, it should be prescribed, and we're getting there. Australia recently really put the spotlight on this, and I was so pleased. I just did a conference this week, of course, virtually, for the Active Aging Summit in Australia next year. Hopefully I'll be there live. So that is kind of it for today. We've discussed prehab and prevention. We've discussed during treatment, immediate recovery, and long-term survivorship, and how exercise plays a critical role. We can help the millions of people out there who are feeling frustrated, alone, sad, discouraged, in pain. Whatever the case is, we have the opportunity to work with them and get them past that. We can be the safety net, providing a safe haven for cancer patients and survivors to get to take control of their bodies and their minds at a time they feel they have no control. And at the end of the day, when you fitness professionals think about what you're doing in life, and I am not minimizing the benefit of bodybuilding and six packs and being ripped and feeling great about yourself, not at all, not at all. But to be able to know that you truly gave someone hope and inspiration and took them from the depths of hell and got them to the other side, I can't tell you what an amazing feeling that is. And I know many of you can relate to this. So that is all I have for today. I am going to open up for questions, and Shannon and I can try and jump in and answer them. We'll put some posts up and handouts today when we're done, and then hope to join you tomorrow, where we will get into acute and chronic side effects of surgery and treatment. And I'll get a little more specific to all of the things that you guys were throwing out there: lymphedema, neuropathy, fatigue, nausea, vomiting, diarrhea. There are so many issues, as well as all the neurological ones. And yeah, Shannon, as you're saying, no one is working in a gym right now. However, there's going to come a time in the not too distant future where these quarantines are going to be released, whether that's good or bad. And it's going to be more important than ever that we practice good hygiene and doing these things that are going to boost the immune system. And if anybody is a registered dietitian or nutritionist and you want to introduce yourself here, great place to do so. And this is also a great way to create a referral network. So introduce yourself, tell us where you live, what you do, what your reason for being here is, and let's start to get some engagement and create a platform that, long after this week is over, we can continue to communicate. And please join the 10-minute quarantine workout, whatever Shannon posted a few spots down. Would love to have you. And if you're a fitness professional, think about a 10-minute workout that you can do that'll work on balance, functional training, breathing, yoga, you name it, as long as you're catering towards, the aging population. Cockeysville's in Maryland, isn't it? Baltimore, yep. Fellow Maryland person. We'll have to meet next time I go see my mom. Does online intuitive eating coaching for oncology. Oh, excellent recommendation. A couple months ago. All right, Shanna, hit me up on my email, please, and I'll give you some information to go along with the ACE course, which is the same as the one we offer through Cancer Exercise Training Institute. That would be amazing, Sherry, and we'll do whatever we can to help you. You're not that far from Shannon. I mean, you guys are in Florida. Yes, absolutely, Patty. Let me see what day we are talking about that. I think, no, I think I get into that tomorrow, Patty. So stay tuned for tomorrow. Oh boy, I can't read these quick enough. I may have to answer them afterwards. That's awesome, Christine. And ACE also has the Cancer Exercise Specialist course as well. Thanks for being here, you guys. Okay, keep writing your questions if you have them. We will answer them. If not, we will see you same bat time, same bat channel tomorrow. Stay healthy and think about 5 things you are grateful for today. I promise you, down to the comfort of your bed, heating, air conditioning, the food you eat, the people who grew the food, the people who brought the food to your grocery store, the people who are working at the grocery store right now to spite the coronavirus. Thank you to all of them, and thank you to all of you. I will see you tomorrow.